Hi, everybody. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist, talking all things on living agelessly, bridging generational gaps, family caregiving, entrepreneurship, just life itself. But today, especially, I am speaking to family caregivers, especially taking care of yourself, but specifically regarding exercise. Hence why to get up. And yeah, I did exercise. I just came from it. May sound a little breathless. I can put this down now. But we're going to talk about some types of exercise, and we're going to talk about why exercise is so important for family caregivers. And you might be thinking, like, "Huh, she must be crazy. Does she expect that I can fit exercise in with all the things I have to do?" Oh, yeah. So, good morning, good evening, good night to wherever you are. This is a channel where you're going to get tidbits, fun, hopefully something you can take away. Share with a friend, share with a loved one. Remember to subscribe, press the notification button so that you can get all the other new information and any questions you may have answered up to date every week. Because I'm going to meet you every week. And also, don't forget to join me for further information on Lana's Little Things. That's my website, www.lanaslittlethings.com. There's way more information on courses you can join for family caregivers to do what? Take care of yourself. One of those is exercise. Yeah. So let's get right into it. I'm not gonna be like, all the didactic things and all the list of things that you've heard a bazillion times about why you need to exercise. You know you need to exercise. I mean, it's true. But what with the cooking and the cleaning and the taking care of, and every 2 minutes you might have to look around for your loved one, especially if they're older, maybe they wander, maybe they just had they you thought they were sleeping, you thought they were resting, no, they're up. You know how it goes. You barely turn your back away for 2 minutes and it's a different story. So you feel as though, well, I have no time to do anything, much less exercise. Think about it though. If you don't get exercise as a caregiver, then how are you going to be able to have a stronger heart, stronger constitution, be able to have like a clear brain, because that's what exercise does, in order to do your caregiving even better? Hmm. Just food for thought, not preaching or nothing, except to be converted. So here are five, just me, three or five reasons why exercise is so important, and maybe three, maybe five different types of exercise that you can do. So let's dive right in. One of the main things that exercise can do that you may be surprised at is it helps you to sleep better. Uh-huh. So you thought that, you're gonna exercise and then you're just worn out, or you're so hyped up, or you're gonna either oversleep or you're not gonna sleep at all. No, research has shown actually that those who regularly exercise, and we're talking American Heart Association, so there is some science I'm going to use to back it up, and that's 4 days a week minimum, 15 minutes to half an hour at a time, and you can break that up. Half an hour is ideal. You can break it into two 15-minute periods. You can break it up into three 5-minute periods. Even if that's all you do, give yourself movement, give yourself something to do, make your body move, get your body moving, please. And it's not just because you'll sleep, the quality of sleep. You know how sleep precious is as a family caregiver. Do you get much of it? Chances are no. So here's what, because insomnia is one of the biggest complaints that I know personally, having when you're there, and also from many of my patients and clients and those I interact with, that's the main thing that they're missing: sleep, quality sleep. And you see that getting up at 2 o'clock in the morning, you know what I'm saying. You can comment down below on which is your like time for when you'd really like to get to sleep and it doesn't happen, or your wake up time, or your downtime if you have any. What is your challenge? Let me know. Let's share. This is a community of sharing. All right. So insomnia is one of the greater complaints, one of the most common complaints I encounter. So what does physical exercise do? Well, obviously, you use all those wonderful, release all those wonderful endorphins that are good for your brain, good for your emotions, good for your energy, good for your mood. But you also do fatigue your muscles. You bring your muscles and you bring your heart and lungs to a state of peak and then rest. And in that rest and recovery, that's where the fatigue and then the nice fall off into calm calmness. Let me just use that word. And then sleep is the quality of your sleep will change, will be better. Trust me. What else does it do? Well, we said it releases the good feel good hormones, so it's good for your mood. Like, do you always feel better? Maybe I seem a little hyper, maybe I seem hyper all the time, but exercise is just so good for your mood. It really does help you to feel better. And doesn't that bring a smile to your face and make the caregiving like a spoonful of sugar? Helps it to go down, you know what I'm saying? So don't do it right before bedtime. Kind of do maybe just up to 7, 8 o'clock at night. Maybe that may be too late. Let's say 6, 7 is your latest. And when you wake up in the day, schedule. Always schedule. Set your phone to it, even if you do 5 minutes. 5 minutes of what, though? So, we'll talk about that later. What's another reason why you need to exercise as a family caregiver? Do you have a lot of lifting to do? A lot of moving around to do? Changing the bed, changing the curtains, moving things, moving linen, moving your loved one, lifting heavier objects, sometimes without help. But you know, that's the reality. Fixing curtains, fixing things, fixing everything, cooking, cleaning, moving, feeding the animals, the pets. The list goes on and on and on. Bending over to pick up something, as simple as that sounds. Exercise, however light, however moderate, but regular, reduces your risk of injury. You bend over to reach something, your back isn't going to give out. And then what? You freeze and no one can take care of anybody then? Mm-mm. What about what about overreaching? You know how that can go. When you overreach to pull, or you go to pull something, or you go to stretch to get something, or you have a sudden move, or something's gonna spill and you want to you jump for it. If your muscles and your joints aren't used to moving, when you ask them to move, they ain't gonna move as smoothly, you know. And then there's a frozen shoulder, there's arthritic pain, there's a torn ligament pain. You're out for the count. Who's gonna do it? You're laid up now. Who's gonna take care of you? Just think about it. Just think about it. So, saw me with the weight. So that's one of the things we're going to talk about. Why strength training is important. But just think of movement in general. Think of a door. If a door or doesn't move on its hinges, and you're going to move it, that's the principle behind joints. Joints are designed to move. A hinge is designed off joints. If you don't open a door regularly, you move. When you go to move it, is it going to move? No, because the hinges are stuck, and you'll be stuck. Okay, just saying. What's another thing? Well, if you get to go outdoors and you have a friend who can give you that 5 minutes, spend it with a friend and just go for a walk up the street and down while someone is there with your loved one. 5-10 minutes. If that is not possible, maybe you can Zoom your exercise. You can meet by Zoom and you can do something that you found on YouTube. Hundreds of videos on YouTube. Hundreds of videos on exercise safely that you can do. Join a friend on the phone, FaceTime, Zoom call. You can still be both at home safely. You can keep an eye on your loved one and you can exercise. No excuses. And your social connection will still be there. So you can have your friends, have your cake and eat it too. You can have your friends and your exercise as well. And your bonding. And you can vent and you can talk and you can drink your water and you can, what we say in Barbados, you can lime, which means you can relax for a little bit. And you feel better again. Another smile on your face. What about reason number what are we at? 4 now? Maintaining your overall health. Non-communicable diseases, hyperpressure, diabetes, high cholesterol, the triplets as I call them, or early osteoarthritis, early joint damage, early muscle weakness, muscle loss as you get older, because most caregivers older, are older age themselves. Let's just face it. And there may be Gen X, there may be the baby boomers who are in 60s and 70s. They're taking care of 80s and 90-year-olds. So you have to be able to take care of yourself. 40s, 50s, 30s, anybody. Maintain your overall health. Exercise. Keep in mind it can ward off serious health illnesses. Now, caveat, please speak with your doctor before you do any exercise program. That won't be me. Like your personal doctor, I'm saying speak to your personal doctor before you start any exercise program. Find out what's good for you. What would they suggest? These are just suggestions. Again, 10 to 20 minutes, but you can break it up. You may need to, what's another one? What's another reason why you need to, what's the fifth reason? This one has really touches my heart. Reduces the depression and anxiety that come from family caregiving, which is a reality. Exercise, again, those feel good hormones calm you down, release those hormones that they reduce the hormones that will be causing anxiety. Your heart rate goes up, which actually makes your heart strong. It goes up while you exercise, but overall it makes your heart stronger. But during that time while you're exercising, all the endorphins, all the good hormones, all the stressed hormones are less, the good ones are better. So physical activity will also, as you're focusing on what you're doing, just take your mind off others and place your mind on self. Remember, the cup your cup has to be full in order for you to give to others. All right? So those are your 5 reasons why. Now we're going to do just 3 types of exercise. We spoke about weight, and you see this is small. It could be bigger, depending on your level of strength. But I'm not telling you to go and be in any competition. Again, speak with your doctor. But using weights is a very good way to strengthen your joints, strengthen your muscle, build muscle tone. It actually stimulates your bones to work. So the cells that build bone are actually stimulated when you do either Pilates exercises, where your body weight is the weight, or weights where you have to give them stimulation. So again, weight training or Pilates. So those are 2. And the third one is obviously aerobic exercise. As you get older, depending on your fitness level, you may or may not be able to do as much aerobic exercise as you'd like to. That may exhaust you. And you may feel too tired to do the caregiving. So we're trying to strike a balance. But bear in mind, it's for your heart, it's for your muscles, it's for your joints, it's for your overall health, it's for your mood, it's for your sleep. Wow, who can say no to that? So, while I go get myself ready for my nighttime sleep to actually feel the good, the it's coming on. Tell me how you felt. Try it. Tell me which exercise worked better for you. Speak to your doctor. Tell me which one you share with us. Share with the community. Again, remember, like, subscribe, and we will meet each other again. And remember, oh yeah, for sure, when you finish exercising, fluids. So, well, I just love this mug. Someone gave this to me. A patient gave this to me. Actually, maybe that's reversed. It says walk by faith. I love it. And this is water. Trust me, it's hot water. Drink your fluids. From my heart to yours, Dr. Lana saying good health to you, exercise, sleep well. Mwah.